pregnancy operation that we use primarily for women who have had children whose skin has stretched out. Oftentimes it's hanging below a C-section scar, and their muscles have spread apart. And it's basically, it's an operation that rejuvenates or returns a woman's stomach back to pre-pregnancy state. You're going to have a long scar. Typically it goes from the hip bone, right at the top of the hairline over the other hip bone. And that enables us, however, to remove all of the skin, basically from here all the way up to here. So typically we'll get a piece of skin yay long, yay high, and about that thick. That will be gone forever. Next one. And so, after we've removed all that skin, we then have to loosen up that skin up above to pull that down. And so that cell right above your belly button, that piece of skin, is going to end up right down at the hairline when we get done with surgery. The other thing we do is that following pregnancy, the rectus abdominis muscles, or kind of the bodybuilder muscles, they spread apart and they never come back together. There's a piece of tissue in the middle. It's called fascia. We call it the linea alba. It spreads apart, and you can do 1,000,000 sit-ups, and it will not pull the actual fascia together. It's good for the muscles, but it doesn't pull those, pull that fascia together. So what we actually do is we give you a surgical corset. Kind of back before the day women would wear corsets, well, we do the exact same thing with heavy-duty sutures from your rib cage down to your pubic bone. And you can see here we've marked out this patient before surgery. Go ahead. Go ahead. And this woman is kind of a panis, a little thickness up here. I mean, you're going to have a long scar down there, but for most people it's covered by the panties. Go ahead. Mommy makeover, I just want to briefly touch on that. That's a term we hear in the media. Basically, it is a combination of operations that we do to basically reconstruct women following pregnancy and childbearing. And it can be tummy tuck. Sometimes we'll do Jim will do a facelift, or there's just a wide variety of things. What I tend to see is tummy tuck and a little bit of a breast lift, or sometimes we do an augmentation to kind of restore some of the volume that's lost with breastfeeding. Post-weight loss surgery, I mean, we're seeing more and more patients that have lost a lot of weight, and obviously there's a number of operations we can do to deal with that. They all basically involve removing excess skin. So if one's gained a lot of weight on the arms, we will go ahead and make that elliptical excision underneath the arm. We call that a brachioplasty. Medial thighplasty, we do the same thing. We'll take out a strip of skin in between there. They're all skin reduction operations. Okay, thank you. Just feel free to ask me or Melody or any of the other surgeons. If you, we're going to hang around, and we're here to allow you to ask questions in kind of a low-key manner. And so, thank you.